the students are online? Are you able to hear me clearly? We are going to start with some of the important topic in revision round. And if any topic are missing, any of the topics are missing, we are going to see that also. Okay, so I am audible. I am getting reply from students. I am audible. So whatever topic you want that I should take for your revision class, that you can WhatsApp me. So for until your exam, we will be taking this online revision classes as per your topic schedule. So I have selected today to revise these drugs for CCF or congestive cardiac failure, or CHF, congestive heart failure, CHF or CCF, that is congestive heart failure, and CCF is congestive cardiac failure. So some of the topic, what I feel that these are important and it may be difficult, that I will be selecting for next classes, as well as some other topics that you can give me also, that you want that this topic should be covered, that I will be taking in revision classes. Or if you feel that this topic is missed or it has been taken rapidly, that you can WhatsApp me. So I will take that topics. And also I wish that apart from pharmacology, any subject, this online facility is giving the facility for any subject class to be discussed. So in any of the subject which is related to medical science, of course not of the physiotherapy, but on any of the medical subjects, that I am prepared, always prepared to take class upon that subject. So we will be today going through this journey of CCF, congestive cardiac failure. Hope you are remembering that drugs also. So congestive cardiac failure or congestive heart failure, let me select the pointer. Okay, so it is the state where heart cannot maintain an adequate cardiac output. Adequate cardiac output cannot be maintained. So that is the state of failure. But remember that here there is no complete failure, means completely heart is not stopped. Only cardiac output, adequate cardiac output is not maintained. So that heart is not able to pump import any pointers in color is not matching. So heart is not able to pump enough cardiac output to meet metabolic demand of the body, to meet metabolic demands of the body. So it is the failing state of the heart, failing state of the heart. So it is we can say that here heart fails as a pump, and as a result congestion occurs. Heart fails as a pump, and as a result congestion occurs. That is congestive heart failure. So almost all form of the heart disease can lead to heart failure. So congestive heart failure, the cause are other heart disease like hypertension. Congestive heart failure can occur because of the hypertension, because of the valve failure, because of the stenosis of the valve, like stenosis of the atrial valve, atrial stenosis, like stenosis of the this valve between atria and ventricle, atrioventricular stenosis or aortic stenosis. The previously was atrioventricular stenosis valve and this aortic stenosis. So because of the stenosis of the valve, because of the hypertension, congestive cardiac failure can occur. Again, I repeat, it is the condition where cardiac output is not enough to meet the metabolic demand of the heart. As you know that heart is having the pumping action. So pumping action of the heart decreases in case of the congestive heart failure. So it is chronic progressive condition that affect the pumping power of the heart muscle. As we have already discussed, pumping power of the heart muscle is decreased. You know that you have the 4 heart chamber, that is the basic anatomy that you already know. We are more interested in the drug. And this paragraph talks about the circulation of the heart. We are not interested in that part. So CHF develops when the ventricle can't pump blood in sufficient volume to the body. So again, that is the repetition, what we have already said, what we have already discussed. So CHF develops when the ventricle can't pump enough blood, and eventually blood and other fluid can take up inside your lungs, abdomen, liver, or lower part of the body. So that is this condition. So there are, according to New York Heart Association classification, according to New York Heart Association classification, there are 4 class 1, class 2, class 3, and class 4. So in class 1, there are no symptoms with ordinary physical activity. So progressing from class 1 to class 4, the disease becomes severe. So class 1 is no symptom, means mild disease, asymptomatic. Heart failure is there, but there is no symptom or ordinary physical activity. Class 2 is symptoms with ordinary physical activity, but comfortable at rest. Patient feel comfortable at rest, but on ordinary physical activity, by doing the routine physical activity, symptoms of congestive heart failure develop. That is class 2. Class 3 is symptom with less than ordinary physical activity. Whatever the routine activities are there, even less activities are being carried out by the patient. At that time also, symptoms of the congestive heart failure develop, but comfortable at rest. So in class 2 and class 3, patient feels comfortable at rest. And class 4, patient cannot carry out ordinary physical activity, any physical activity, not even ordinary, any physical activity, and symptoms are present even at the rest, and symptom increase with the increase in physical activity. So class 1, no symptoms on physical activity. Class 4, symptoms develop at any physical activity even during the rest. And class 2 and class 3, patient is comfortable at physical on the rest, but on physical activity, in class 2 ordinary physical activity, symptom develop. Class 3, less than ordinary physical activity, even symptoms develop. So these are the classification. This may be useful in your medicine part also. So what are the symptoms? We are talking about this New York Heart Association classification. Here the symptom, what symptoms are written. So what are the symptoms? So symptoms of left and right and biventricular heart failure. So here symptoms of the left heart failure and symptoms of the right heart failure. If you remember this figure. So left heart failure. So what is the function of left heart? Left heart pumps blood into the circulation, So here, because of the left heart failure, means left ventricular failure, blood is not enough pumped into circulation. So symptoms because of this pumping failure, this will be developed. So here, because of this, you know that there will be back pressure of the blood. You know that blood is coming from vena cava, superior and inferior vena cava. So here there will be back pressure over the superior and inferior vena cava. First of all, because of the inferior vena cava blood pressure, there will be pitting edema. Here there is edema of the feet. Then because of the pressure over this pulmonary vessels, there will be pleural effusion. Cardiomegaly. Why there is cardiomegaly? Because heart is trying to pump the blood, and in that efforts, heart ventricular muscles, they are enlarging. So because of this, there will be cardiomegaly. Plus there will be dilatation, cardiac dilatation, because enough blood is not pumped into circulation. So blood is remaining into the ventricle, and it will lead to cardiac dilatation. So because of this cardiac dilatation as well as thickening of the ventricular muscle, in order to pump the blood, there will be cardiomegaly. Because of the back pressure over the pulmonary vessel, there will be pulmonary edema. Because of the back pressure over the jugular vein, there will be raised jugular venous pulse. So raised JVP, pulmonary edema, cardiomegaly, pleural effusion, pitting edema. These are the symptoms of left heart failure. In right heart failure also, there will be raised JVP. In addition to this, there will be hepatomegaly. Because of the congestion of the vessels over the liver, there will be ascites, abdominal fluid, accumulation of the abdominal fluid. So in right heart, blood primarily comes from left, but there will be congestion, back pressure over the liver as well as over the abdominal vessels, which will be leading to hepatomegaly and ascites. Plus pitting edema is always present in left and right, both the heart failure. So these are the symptoms of left and right heart failure. Then therapy of the CHF. Treatment of the CHF is aimed at correction of the reversible cause. So cause correction. Then diet and activity. Reversible cause means suppose the cause is hypertension. So if you control blood pressure, then congestive heart cardiac failure can be also controlled. Diet and activity, it includes salt restriction extreme of temperature and heavy physical exertion should be avoided. Means extreme of the heat, extreme of the cold, because it will provoke the congestive heart failure. Heavy physical activity should be also avoided. Drug that worsen CHF, that provoke the CHF, it should be avoided, including NSAIDs and drug therapy. So treatment of therapy include this drug therapy, and that we are going to discuss. So drug therapy include inotropic drugs, diuretics, vasodilators, beta blockers. So in inotropic drug, there are three drugs: digoxin, dopamine, and dopamine. There are more other drugs, but you can remember these three drugs: digoxin, dopamine, and dopamine. These are inotropic drug. Diuretics include furosemide and thiazide. Thiazide diuretic. Thiazide, you know that hydrochlorothiazide. Spironolactone. This is potassium channel opener. Aldosterone antagonist also. Vasodilator include SAE inhibitor, angiotensin converting enzyme inhibitor, or ARB, that is angiotensin receptor blocker, hydralazine, prazosin, that is alpha blocker. Because of the alpha 1 blockade, there will be vasodilatation, sodium nitroprusside, and nitrates. Beta blocker include metoprolol, bisoprolol, and carvedilol. So I am keeping this slide in front of you. Try to remember the names of the drug which are used for congestive cardiac failure. I am keeping this slide for 1 minute in front of you. Try to remember the names of the drug. Remember that this is revision class. The students who have joined recently, I have told that whatever the topic you feel in pharmacology, first in pharmacology, then in any other subject, if you want that this topic should be taken by me, that I will be taking online. Take this opportunity to learn more and more things. And if you feel that if any of the topics is missing in pharmacology syllabus, you can go through the syllabus, as well as you can go through the last 5-year exam papers. And if you are feeling that any of the topics are missing, that you can directly WhatsApp me, that I will be taking in later on. So we will be continuing with this. We can say that this is a form of crash course of pharmacology, or you can say that crash course of your syllabus. So it will be helping you in revision, and it will be helping you. Soon your exam will be conducted. I think now university are preparing for taking exams, and you will be getting the message, similar message also. So it will be helping you in your preparation. Okay, so first of all, we are going to see about inotropic drug, that is digoxin. There are two drugs in inotropic agent, and these two drugs are known as digoxin and digitoxin. Let me select if any other ink color works. This digoxin and digitoxin, these are two cardiac glycosides. These are two cardiac glycosides, and these are also called as digitalis. These are also called as digitalis. Commonly, these are digitalis. So, digoxin, digitoxin, and digitalis. So, what is the primary action? That increase force of contraction. These drugs increase force of contraction and cardiac output. So we need this activity. You know that in case of the congestive cardiac failure, force of contraction is decreased. So these are the drugs which increase force of contraction and cardiac output without increasing heart rate. So these drugs are called cardiotonic drug. Cardiotonic drug. We need not to understand this chemistry. We need not to also remember the source. So name of the drug, remember the names of the drug. Try to remember right now. Digoxin, digitoxin. Try to remember the action, increase force of contraction and cardiac output without increasing heart rate. So that is beneficial effect. So without increasing heart rate. So these drugs are called as cardiotonic drug. Now, effect. What are the effect on heart? So in failing heart, it increase force of contraction. That is same as we have discussed. and that is dose dependent. Means if you increase dose, there will be more increase in force of contraction, as well as it increase cardiac output. So that is the first action: increase force of contraction, increase cardiac output. Second action, it slows AV conduction. AV conduction, that is ventricular conduction, is slowed through AV node, and because of this there will be bradycardia. So increase force of contraction, increase cardiac output, bradycardia. Then there will be more complete emptying of the failing and dilated ventricle. Understand this very well. Because there is increased force of contraction, ventricle empties more completely than the failing heart. Suppose in case of the failing heart, ventricles emptying properly. So here these drugs help to empty the failing because force of contraction is increased. Force of contraction is increased, and in dilated ventricle also there will be helping in increasing the emptying. So and that's why there is increased cardiac output. That's why there is increased cardiac output. In SA node and AV node, automaticity is reduced. Automaticity is reduced at therapeutic concentration. They may increase myocardial contractility and output. So myocardial contractility and cardiac output is increased in hemodynamic heart without proportionate increase in auto consumption. This is very important. Heart rate heart rate is decreased, force of contraction is increased, and cardiac output is increased, but auto consumption, that is not increased. With that we do not want. Why auto consumption is not increased? Because there is bradycardia. Because of this bradycardia, auto consumption is not increased. So basically you can remember this effect on heart: increased force of contraction, increased cardiac output, bradycardia, more complete emptying of the failing ventricle. This, if you can forget, that is also well. This is not important right now. And auto consumption is not increased. That is important. So mechanism of action: how these actions of increasing force of contractions are produced. This increase in because of the increase in intracellular calcium ion by blocking sodium potassium ATPase pump. Remember, in simple one line, mechanism of action of digitalis, or we can say digoxin or digitoxin, both are similar. By blocking sodium potassium ATPase pump in cardiac myocytes, cardiac muscles. So as you know that for increasing force of contraction, for increasing muscular activity, calcium is needed. So this drug helps in increasing intracellular calcium ion. How? By blocking sodium potassium ATPase pump in cardiac myocytes. So that is very simple. So you can see this by figure also. You are aware of this figure, actin myosin. This is figure of actin myosin. Then this is sodium potassium pump. This is sodium potassium pump. By blocking this sodium potassium pump, there will be increased entry of the calcium into cardiac myocyte. This is cardiac myocyte, and this is sarcoplasmic reticulum. This structure is sarcoplasmic reticulum. So this calcium entered into cardiac myocyte will increase more calcium release. It will be causing more calcium release, and it will be helping in contraction by this actin myosin chain. So basically, to increase calcium level, it has to block sodium potassium ATPase pump. So this is again through the figure. Effect on blood vessel: there are no prominent effect on the blood pressure. So it can be not, it cannot be, so can be given in hypertensive patient. Effect on CNS: there are little effect on the CNS at therapeutic dose, but higher dose can activate chemoreceptor trigger zone. It can activate chemoreceptor trigger zone. And what happens due to activation of the chemoreceptor trigger zone? If you remember, what happens due to activation of the chemoreceptor trigger zone? CTZ, chemoreceptor trigger zone. If chemoreceptor trigger zone is activated, what happens? What is the effect? It is considered as the side effect actually. Do you remember? due to activation of the chemoreceptor trigger zone, what happens? You can answer in chat box. Because of the activation of the chemoreceptor trigger zone, there is one side effect. It will lead to nausea and vomiting. Then higher dose can also lead to hyperapnea, central sympathetic stimulation, mental confusion, disorientation, and visual disturbances. So these are the effect on CNS. So because of the higher dose, it will lead to hyperapnea, mental confusion, sympathetic stimulation, disorientation, visual disturbance. Pharmacokinetic, we are not interested. Adverse effect. So toxicity of the digitalis is very high. Digoxin is very high, and margin of safety is very low. So it is called a therapeutic index. It is between 1.5 to 3. So there are extra cardiac side effect and cardiac side effect. Extra cardiac side effect and cardiac side effect. So extra cardiac means these are the side effects which are apart from the heart. So initially there can be anorexia, nausea, vomiting. Why? We have to say that because of the stimulation of the CTZ, diarrhea, abdominal pain. So anorexia, nausea, vomiting, diarrhea, abdominal pain. There can be fatigue, malaise, headache, mental confusion, restlessness, hyperapnea. Just we have seen in CNS, disorientation, psychosis, and visual disturbances. So these are the effect. These all are effect of because of the stimulation of CNS. Skin rashes and gynecomastia. It can happen rarely. Cardiac side effects are bradycardia, AV block. AV block we have seen in case of the heart. It is causing heart AV block, and because of the AV block there is bradycardia, or any type of arrhythmia can also occur. So I am keeping in front of you this adverse effect, extra cardiac and cardiac. You can remember, try to remember this adverse effect, extra cardiac and cardiac adverse effect. Try to remember this adverse effects. I am keeping this slide in front of you. Okay, now we are moving further. Pooja had replied previous question, vomiting. Actually, I may have received it late. Treatment of digitalis toxicity. So if there is such toxicity, if it develops, we have to treat it. So first of all, stop digitalis. So first line of treatment is stop digitalis, because toxicity is occurring because of this. On earliest sign of toxicity, for treatment, potassium chloride can be given. If toxicity is due to chronic use or use of diuretic, so potassium chloride can be helpful in treatment. So with the level of the potassium chloride, how much potassium chloride is to be given, it is guided by potassium measurement, serum potassium measurement. If there are arrhythmia, so we have seen that last side effect, that is any type of arrhythmia can develop. If the arrhythmia is irregular heart rate, irregular cardiac activity. So in case of the ventricular arrhythmia, lignocaine IV can be given. Supraventricular arrhythmia, propranolol can be helpful. AV block and bradycardia, in that condition, atropine can be helpful. Atropine, we know that it is anticholinergic. Propranolol, we know that it is beta blocker drug. Lignocaine, we have also studied in case of the anesthetic. Digoxin antibody, it is very effective and but not used in our part. So basically we are using according to arrhythmia, whatever the arrhythmia are there, this type of the drug can be given in digitalis toxicity. Contraindication of the digitalis, in which condition it should not be given? Hypokalemia, because it itself causes hypokalemia. So in case of the serum potassium level is already low, digitalis cannot be given. In case of the elderly patient, renal and severe hepatic disease, because these patients are more sensitive, so digitalis cannot be given. In hypothyroidism, because it will cause low elimination. In ventricular tachycardia, because it already causes ventricular arrhythmia, it already arrhythmia, ventricular tachycardia. So we cannot give. In case of the partial AV block, why? Because it already causes AV block. So we cannot give into a patient who are having partial AV block. It can convert it to complete AV block. So already in hypokalemia, this elderly renal severe hepatic disease, hypothyroidism, ventricular tachycardia, and partial AV block, we cannot give digoxin. So try to remember this contraindication. I am keeping this in front of you for 30 seconds. Try to remember this. I hope that your digoxin is prepared now only. Okay, so while preparing this, let me ask the questions. Write down the mechanism of action of digoxin in chat box. What is mechanism of action of digoxin? Write down its mechanism of action in chat box. Mechanism of action of digoxin in chat box. Write down the mechanism of action of digoxin in chat box. Write down the mechanism of action of digoxin in chat box. We have just discussed. I am waiting for the reply. What is mechanism of action of digoxin? Write it in chat box. And second question also simultaneously. Okay, I'm getting reply. It increase intracellular calcium by blocking sodium, potassium, ATPase pump. Very good. Increase the force of contraction of the muscle. That is action. Very good. So that was my second question. That what are the effect of digoxin on heart? We have discussed some of the effects of digoxin on the heart. So what are the effects of digoxin on heart? So I getting reply of mechanism of action. Increase intracellular calcium by blocking sodium, potassium, ATPase. Very good. Khyati, Rakshaba have replied. Also Niri has replied. Intracellular calcium by blocking sodium, potassium pump. Lalit has replied the action. So what are the actions? What are the actions on heart? What are the effect on heart? Yes, Sprinkle is also saying increase intracellular calcium level by blocking sodium TPS pump. Very good. So this is mechanism of action. So effect on heart. Yes, I'm getting reply. Nikita says bradycardia. Very good. Then what are other effects on the heart? What are other effects on heart? Bradycardia, AV block. Yes, Kathy says. What are other effects? Still, some of the effects are remaining. Some effects: increase in force of contraction, very important effect. Yes. Then okay, bradycardia, it has been already taken. What about the emptying? Emptying. Okay, very good. Yes, one important. Not increase auto consumption. Very nice. Not increase. And see, increase auto consumption. There will not be increase of the auto consumption. Even if there is increase in force of contraction, there is no increase in auto consumption. What about the emptying of the ventricle? Effect of on emptying of the ventricle. Okay, meanwhile, we are moving further. So contraindication we have seen. Interaction, we are not interested in interactions. Uses of digitalis. In first use, basically which is it is meant for congestive heart failure. So of course the use is congestive heart failure. but it is not commonly used. It is very nice drug, but it is not commonly used because of the low margin of the safety. Low margin of the safety, because your toxicity of these drugs are very high, as you have seen that extra cardiac and cardiac toxicity, unable to reverse or retard the disease progression. It cannot reverse disease progression. Already congestive heart failure has developed, it cannot reverse the condition. So, but however, it can be the drug of choice in congestive cardiac failure when there is dilated heart and low ejection fraction. Ejection fraction is amount of blood that is ejected by ventricle, that is ejection fraction. Then with atrial fibrillation, if patient is having CHF plus atrial fibrillation, this drug can be given, or if not controlled by other drugs, or in case of the resistance cases, digitalis can be given. So the dose is depending upon the plasma concentration. So the plasma concentration should be maintained between 0.8 to 1.2 nanogram per deciliter. So there should not be increase beyond this 1.2, or there should not be decrease between 0.8. So if it is below 0.8, it will not be giving any effect. If it is above 1.2, there will be increased chances of the toxicity. So we have to maintain in this very narrow range. That is called, why it is called as low margin of the safety. So it is digitalization. Stable clinical state for 2 to 3 months can be achieved, and withdrawal digitalis therapy can be attempted after the stable condition state is achieved. So first use is congestive heart failure. Then in cardiac arrhythmia, it can be used. Second use is cardiac arrhythmia. Which type of the cardiac arrhythmia? Atrial fibrillation, atrial flutter. In this condition, these are the cardiac arrhythmia. And third is paroxysmal supraventricular PSVT. So atrial fibrillation and PSVT, paroxysmal supraventricular. In this cardiac condition, it can be used. Atrial flutter and atrial fibrillation are both abnormal heart rhythms. This is why that is why it is called as arrhythmia. In atrial fibrillation, atria beats irregularly. In atrial flutter, atria beat regularly but faster than usual. So that is the difference between atrial fibrillation and atrial flutter. In atrial fibrillation, atria beat irregularly. In atrial flutter, atria beat regularly but faster. So it can be the rate, and in case of the atrial flutter, atrial rate can be more than 200, 250 also per minute. And dose of this drug in case of the atrial fibrillation and flutter is 0.125 to 0.25 milligram POMS per oral or IV can be given. It is available as Lenoxin, that is the drug brand name, 100 tablets. 0.25 milligram is the strength of this digoxin. Lenoxin contain digoxin. So that was the first drug in case of the congestive heart failure. Now second drug is diuretic. So high selling diuretics are preferred, but thiazide and spironolactone can be also added to overcome the resistance. High selling diuretics means the diuretics which are having the high ceiling effect, means if you increase the dose, the effect will also increase. So such as furosemide. We have seen already the names of the diuretic. Furosemide can be used, as well as thiazide and spironolactone can be also used. So what is mechanism of action of diuretic? It increases sodium and water excretion. Diuretic will increase sodium water excretion, so there will be decrease in extracellular fluid volume. ECF fluid volume will be decreased. So as you know that in case of the congestive heart failure, if you decrease the fluid volume, so the load over the heart, that will be also decreasing. So it will decrease preload and improve ventricular efficacy. So because of the decrease in preload, ventricular efficacy will be increased. Again, I repeat, under the effect of diuretic, sodium and water excretion will be increased. So ECF, extracellular fluid volume, will decrease, and it will lead to decrease in preload and improve ventricular efficacy. It can remove edema and congestion also because of the diuretic effect. As you have seen the symptom, edema and congestion, it can be also improved because of the excretion of the water. So IV furosemide, it can increase venous capacitance also, and it can give quick symptomatic relief. IV furosemide give quick symptomatic relief, but do not influence this disease process. Again, as like this digoxin, disease process cannot be reversed. So it can be used intermittently and require low dose. So high ceiling diuretic that can be used, increase sodium water excretion, decrease preload, decrease the CF volume. IV furosemide can be used and it can give symptomatic relief. Spironolactone, that is aldosterone antagonist, it can decrease morbidity and mortality in patients with severe heart failure. So spironolactone is very useful. It can be used in low doses as an add-on therapy with other ACEIs, means angiotensin converting enzyme inhibitor. Beneficial effect of spironolactone is low, and it will be contraindicated in patient with renal insufficiency and patient with hyperkalemia. So that was about diuretic. Then ACE inhibitor or angiotensin receptor blocker. And ACE means angiotensin converting enzyme inhibitor. So these are the orally active medium efficacy mixed dilator. Mixed dilator means it can dilate vein and it can dilate artery also. Mixed dilator means venous dilator and arterial dilator. So because of the venous dilation, what happens that that is useful in CHF. So there will be decreased venous return. Venous dilation will lead to decrease in venous return to the heart. So there will be decreased ventricular and diastolic pressure and volume. So when whatever the blood is coming to the ventricle, that will decrease. Simply meaning because of the venous dilatation, blood coming to the ventricle will decrease. So ventricular pressure and volume will decrease, and it will reduce ventricular size and improve systole. It will going to decrease this ventricular size and improve the systole. So how it is useful in case of this CHF. Because of the arterial dilatation, there will be decrease in afterload. Because of venodilatation, we can say that there is decrease in preload. Because of arterial dilatation, there is decrease in afterload. So even weaker ventricular contraction can pump the more blood. We know that in case of the CHF, pumping action has failed. So even weak ventricular contraction, because of the decrease in afterload, it can pump more blood effectively. So it is useful. Decrease aldosterone release also. These are the drugs which are recommended for all grades of the CHF, class 1 to class 4. All grades of the CHF, these drugs are useful, and especially with the patient with left ventricular dysfunction. Advantage of angiotensin converting enzyme inhibitor that afford symptomatic relief. They afford symptomatic relief. It can reverse ventricular hypertrophy also, and it can reverse myocardial cell apoptosis and remodeling also. So apart from having the symptomatic relief, SCA inhibitor can reverse ventricular hypertrophy and myocardial cell apoptosis also. Role of other vasodilator like nitrate. Nitrate can be used as venodilator. Hydralazine and minoxidil, that are the arterial dilator. Trazocine and nitroprusside, these are mixed dilator. So these are the drugs which are other dilator. So because of the vasodilatation, basically you can remember that vasodilatation, if there is arterial dilatation, it can lead to decrease in afterload. If there is venodilatation, it can lead to decrease in preload. I think we will keep up to this today, and we will be meeting in next week. We'll keep up to this. Just write down in chat box how diuretics are useful. How diuretics are useful. Let me check that if you have understood this properly or not. How diuretics are useful in CHF. Write down in chat box. And name of the diuretics also. How diuretics are useful in CHF. As well as you can write down the names of diuretics which are useful. What is action of diuretic in CHF? How diuretics are beneficial in CHF? I'm waiting for your reply. How diuretics are useful? What are the effects of diuretic in CHF? We have just recently discussed. And names of diuretic. I'm waiting for your yes names. Furosemide, spironolactone, thiazide. Yes, very nice. And how these are useful? Yes, Kathy is replying. Increase sodium and water excretion and decrease ECF volume and decrease preload. Very good. Okay. So we will be ending today and we will be meeting in next week. You can share me your topics also, whatever the topic you want. Otherwise, I will be keeping from my side. I will be whatever the topic I feel important and difficult for you, that I will be taking. Okay, thank you very much.